Have you ever observed how specific illnesses can emerge unexpectedly, causing feelings of confusion and worry? In today's video, we will explore 10 diseases that serve as important indicators of your body's communication with you. Recognizing these signs is essential as they may indicate underlying concerns that, when properly addressed, can contribute to a healthier and more fulfilling life. Join us throughout this journey to uncover practical knowledge that will enable you to manage your health effectively, make educated choices, and enhance your overall well-being. Before we start, I would be grateful if you could like this video to assist me in sharing valuable insights on aging. If you haven't subscribed yet, I highly encourage you to do so and activate the notification bell to ensure you stay updated with all the videos. If you found this video helpful, kindly leave a comment with the number 1. If you have any feedback, please comment with a 0 to help me improve future videos for your benefit. Let us begin our journey. First and foremost, obesity is a complex health issue marked by an excessive buildup of body fat, generally identified by a body mass index, BMI, of 30 or above. The outcome is typically influenced by a combination of genetic, environmental, and behavioral elements, often serving as a clear indication of poor lifestyle decisions. These options might consist of a diet rich in processed foods, sugars, and unhealthy fats, along with a lifestyle that is predominantly sedentary and devoid of regular physical activity. Addressing obesity is of utmost importance, as it is linked to numerous serious health complications that can significantly affect both the quality and longevity of life. People with obesity face a significantly heightened risk of encountering long-term health issues, including type 2 diabetes, which impairs the body's capacity to manage blood sugar levels effectively. This condition has the potential to result in additional complications, such as nerve damage, kidney failure, and cardiovascular disease. Alongside diabetes, obesity significantly contributes to cardiovascular diseases, such as heart disease and stroke. The emergence of these conditions is linked to a variety of factors, including high blood pressure, increased cholesterol levels, and inflammation, which tend to be more common in those with excess body weight. Moreover, excess weight can notably elevate the likelihood of developing specific cancers, such as breast, colon, and prostate cancers, as a result of the impact that surplus fat has on hormone levels and inflammation. In addition to the physical health consequences, obesity can significantly impact mental and emotional wellness. Numerous individuals affected by obesity encounter stigma and discrimination, resulting in feelings of isolation, diminished self-esteem, and mental health challenges like depression and anxiety. The recurring relationship between obesity and mental health issues can significantly hinder individuals from pursuing assistance or implementing essential lifestyle modifications to successfully address obesity and reduce its related health risks. It is crucial to dedicate oneself to a thorough and lasting lifestyle transformation. This dedication starts with embracing a balanced diet that highlights whole, nutrient-rich foods while reducing the intake of processed and high-calorie products. A balanced diet must encompass a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Strategically organizing meals in advance and engaging in mindful eating practices can empower individuals to select healthier food options and steer clear of impulsive eating habits. Alongside dietary modifications, it is essential to integrate consistent physical activity into everyday routines to achieve and sustain a healthy weight. Participating in a minimum of 150 minutes of moderate-intensity aerobic activities each week, like brisk walking, cycling, or swimming, can greatly aid in weight loss and enhance overall well-being. Engaging in strength training exercises a minimum of 2 days each week can contribute to the development of lean muscle mass, enhancing metabolism and supporting effective weight management. Understanding that implementing these changes may pose difficulties, it is advisable to seek professional assistance. Engaging with a registered dietitian offers customized dietary advice that aligns with personal tastes and requirements. A qualified fitness professional can provide customized exercise programs and approaches to help individuals stay motivated and responsible during their fitness journey. Alongside expert advice, having a nurturing community can greatly enhance well-being. Connecting with friends, family, or support groups centered on health and wellness can offer motivation. Exchange success stories and cultivate a sense of community among individuals pursuing similar objectives. 2. Cardiovascular disease, specifically SVAD, stands as a prominent factor contributing to illness and death globally, highlighting its importance as a major public health issue. Cardiovascular disease frequently signals the existence of risk factors that can significantly affect a person's long-term health results. Significant risk factors linked to SVAD encompass elevated cholesterol levels, which may result in plaque accumulation within the arteries, causing them to narrow and impeding blood circulation. Moreover, smoking is widely recognized as a significant factor in cardiovascular issues, as it harms blood vessels and encourages clot formation. A sedentary lifestyle, marked by extended durations of inactivity, intensifies these risks by promoting obesity and elevating blood pressure. The combination of these factors can lead to significant heart-related challenges, highlighting the necessity of early recognition and intervention to effectively reduce the risks linked to cardiovascular disease. Individuals should emphasize the importance of regular health screenings, particularly concentrating on cholesterol levels and general heart health. These screenings act as vital diagnostic instruments, allowing healthcare providers to detect potential issues early and take necessary actions. In addition to screenings, implementing lifestyle changes is essential for minimizing risk factors and improving cardiovascular health. One of the most significant improvements a person can undertake is to stop smoking. Extensive research has shown that quitting can greatly reduce the likelihood of developing cardiovascular issues and enhance overall heart health. For individuals facing challenges in quitting, a range of resources such as support groups, counseling, and medication can offer valuable assistance and motivation. Alongside the decision to quit smoking, enhancing physical activity is an essential measure to consider. Participating in consistent physical activity, including aerobic exercises like walking, jogging, swimming, or cycling, can enhance heart strength, boost circulation, and reduce blood pressure. It is advisable for individuals to strive for a minimum of 150 minutes of moderate-intensity aerobic exercise weekly. In addition to engaging in muscle-strengthening activities of autoimmune diseases and their management requires a deep understanding of how genetics and environmental factors interact. For example, individuals with a family background of autoimmune disorders might discover that particular environmental factors, like stress or certain dietary selections, can greatly impact the development or worsening of their symptoms. Effectively managing autoimmune disorders necessitates a comprehensive and forward-thinking strategy that addresses multiple facets of health and lifestyle. Maintaining a balanced diet that is rich in anti-inflammatory foods is essential for effective management. Including a diverse range of fruits and vegetables in your diet is crucial for obtaining vital vitamins, minerals, and antioxidants that help reduce inflammation. Foods abundant in omega-3 fatty acids, including fatty fish like salmon and mackerel, as well as flax seeds and walnuts, are recognized for their anti-inflammatory benefits. Furthermore, incorporating whole grains, legumes, and beneficial fats such as olive oil and avocado into your diet is essential. Conversely, it could be advantageous to minimize or remove processed foods, refined sugars, and trans fats, as these can lead to inflammation and various health concerns. Alongside dietary modifications, it is crucial to address stress management in the treatment of autoimmune disorders. Chronic stress is recognized for its ability to worsen symptoms and provoke flare-ups in those affected by these conditions. Incorporating practices that alleviate stress into your everyday life, such as mindfulness meditation, yoga, deep breathing exercises, or pursuing hobbies that bring you happiness, can greatly enhance your mental and emotional health. Additionally, engaging in consistent physical activity suited to your abilities can elevate your mood, alleviate stress, and boost overall physical well-being. Being knowledgeable about your health status is essential. Consistent medical evaluations with specialists in autoimmune conditions are essential for monitoring your well-being, modifying treatment strategies when needed, and tackling any emerging symptoms effectively. These specialists can provide essential knowledge regarding the most recent studies, therapeutic alternatives, and adaptive techniques customized for your unique situation. Additionally, engaging with support groups, whether virtually or face-to-face, can foster a sense of belonging and shared understanding, offering both comfort and empowerment. By implementing these proactive measures, embracing a balanced, anti-inflammatory diet, managing stress through various techniques, and fostering open communication with healthcare providers, you can greatly improve your quality of life. This thorough method of handling autoimmune disorders not only tackles the physical symptoms but also promotes emotional strength and enhances your sense of control over your health and overall well-being. Fourth point, as we move into our later years, it is common for many individuals to experience the perplexing issue of forgetfulness, which can be both frustrating and confusing. It is quite typical to experience moments of distraction, where we may struggle to retrieve recent words or find ourselves searching for misplaced items like keys or cherished books. Although these memory lapses can be unsettling and may occasionally cause anxiety, it is important to understand that they do not necessarily indicate the beginning of dementia or any significant cognitive deterioration. Rather, they represent a normal progression of aging that influences the brain in multiple ways. The brain acts as the central hub of our body, managing a wide range of functions and activities, from basic actions like walking to intricate processes such as reasoning and decision-making. As we grow older, there is a gradual decline in the number of neurons in our brain, leading to subtle shifts in our ability to process and retrieve information. The reduction in neuron count is a typical aspect of aging, which may present itself through various symptoms such as occasional lapses in memory or challenges in articulating thoughts during discussions. Fortunately, there are effective strategies we can implement to mitigate this decline and enhance our cognitive well-being. Participating in consistent physical activity has demonstrated benefits for enhancing blood circulation to the brain, thereby nourishing our neurons and supporting overall well-being. Similar to how our muscles need physical activity to stay robust and effective, our brains flourish with stimulation and engagement. Furthermore, engaging in activities that stimulate our cognitive functions, like reading, journaling, solving puzzles, or acquiring new skills, can greatly boost brain activity and enhance memory retention. Engaging in these stimulating activities not only enhances cognitive sharpness but also cultivates a profound sense of achievement and happiness. While it is common to notice some level of memory decline as we grow older, it is important to address this facet of aging with compassion and proactive measures, rather than giving in to anxiety or apprehension about memory lapses. We can engage in pursuits that enhance our mental acuity and support our cognitive well-being. Incorporating regular mental exercises into our daily routines, such as engaging in discussions, playing strategy games, or exploring new hobbies, can help us maintain and even enhance our memory and overall brain health. This proactive approach enables us to embrace the journey of aging with assurance, strength, and enthusiasm, highlighting that our cognitive skills can thrive at any stage of life. If you are continuing to engage with this video and are finding the lessons beneficial, kindly comment the number 2 below to indicate your ongoing participation in this learning experience. I appreciate your time and attention. Fifth point, prostate enlargement, medically known as benign prostatic hyperplasia, is a common occurrence in the male reproductive system, especially as men age. The prostate gland is essential for male reproductive health, primarily producing seminal fluid that nourishes and transports sperm. As men grow older, this gland frequently experiences a gradual enlargement due to the increase in prostate tissue, a change that is particularly evident in senior men. Prostate enlargement is a prevalent occurrence, often seen as a natural part of the aging journey for many individuals. In most instances, prostate enlargement does not lead to considerable discomfort or serious symptoms, making it a largely harmless condition. Some men may experience mild urinary issues, including increased frequency of urination or difficulty initiating urination. However, these symptoms are generally manageable and do not significantly disrupt daily activities. It is crucial to note that even with the enlargement of the prostate, it frequently does not apply significant pressure on the urethra. the conduit that facilitates the passage of urine from the bladder, enabling the majority of men to sustain normal urinary function. Consequently, numerous individuals discover that their general urinary well-being remains mostly stable. Even with the increase in prostate tissue, the development of prostate enlargement typically unfolds slowly and steadily, advancing at a more controlled rate than other health issues that might pose greater threats to overall health. While BF may cause observable alterations in urinary patterns, it seldom leads to functional impairment that necessitates intensive medical treatment or surgical procedures. A considerable portion of men experience prostate enlargement during their lives, often without requiring specialized medical intervention or treatment. This emphasizes that although prostate enlargement is a frequent and expected aspect of aging in men, it generally does not lead to significant health issues. Instead, it is frequently observed rather than subjected to active intervention. Consistent consultations with a healthcare professional are essential for thoroughly evaluating and effectively managing any alterations in urinary health. Regular checkups enable men to remain aware of their prostate health and implement any needed lifestyle changes, highlighting the significance of taking charge of their health as they grow older. Sixth point, blurred vision. Blurred vision is a notable and important sign of the natural aging process impacting our eyes. As we grow older, our bodies undergo numerous transformations, and our eyes are certainly not immune to this process. A significant change that takes place is the gradual reduction of elasticity in the eyeballs. The reduction in elasticity directly affects the lenses of the eyes, hindering their ability to adjust and focus on objects at different distances, which is essential for preserving clear vision. As time progresses, these lenses gradually lose their ability to accommodate, resulting in challenges with focus, especially for activities that demand near vision. Presbyopia is a prevalent vision concern that often arises with advancing age, usually appearing in middle age. Presbyopia becomes more noticeable as we grow older. Many people begin to observe this condition once they reach their 40s, often holding reading materials like books or newspapers at a greater distance to see them more clearly. Consequently, straightforward but vital activities such as reading a book, using a computer, or even looking at a menu can become quite frustrating obstacles. The deterioration in focusing ability can significantly hinder daily tasks and impact overall quality of life, highlighting the necessity of exploring solutions to preserve visual clarity and promote eye health. To address the impact of aging on vision, it is essential to embrace healthy lifestyle practices. A well-balanced diet abundant in diverse vitamins and antioxidants is essential for supporting eye health. Nutrients like vitamin C, vitamin E, lutein, and omega-3 fatty acids are known to promote healthy eye function and could potentially lower the chances of experiencing vision issues related to aging. Moreover, participating in consistent physical activity is vital, as it improves blood circulation and contributes positively to overall eye health. In addition to dietary and lifestyle factors, it is essential to emphasize the importance of regular eye examinations. Regular checkups act as a proactive strategy, allowing healthcare professionals to observe changes in vision and identify potential issues early on. Thorough eye examinations are essential for detecting conditions like glaucoma, diabetic retinopathy, and macular degeneration, which often show no symptoms until they progress to more severe stages. Timely identification is crucial for effectively managing these conditions and safeguarding vision. It is crucial to highlight that vision issues in older adults are not merely a result of the natural aging process. Although cataracts are often linked to the aging process, various other factors can also contribute to their development. For example, hereditary factors can have a considerable impact. People who have a family background of eye diseases might face an increased likelihood of experiencing comparable issues. Additionally, past eye injuries may result in enduring consequences that lead to vision impairment as one ages. Specific health conditions, including diabetes and hypertension, are associated with a heightened risk of eye-related problems, underscoring the significance of maintaining overall health to reduce these risks. Environmental factors like extended exposure to ultraviolet light without proper protection, or the cumulative impact of blue light from screens, can significantly worsen vision issues associated with aging. This situation highlights the necessity of adopting protective strategies, including the use of sunglasses when outside to guard against harmful UV rays and employing blue light filters on electronic devices to reduce possible harm. By implementing these measures, individuals can enhance their eye health and preserve clearer vision as they progress through the aging journey. If you are continuing to engage with this video and are finding the lessons beneficial, kindly comment number 3 below to indicate that you are still following along with me. I appreciate your valuable time. Number 7. Osteoporosis. Osteoporosis is a significant health concern marked by the gradual weakening of bones, resulting in increased fragility and a greater risk of fractures. The term osteoporosis refers to bones that have become porous, highlighting the structural alterations that take place in the bone matrix as it gradually loses density and strength over time. This condition frequently progresses without noticeable symptoms, leaving individuals oblivious to their deteriorating bone health until a fracture takes place. The gradual loss of calcium and other vital nutrients significantly contributes to the development of osteoporosis. With advancing age, our bodies experience a decline in the ability to absorb essential nutrients, leading to a reduction in bone density that may render bones more fragile and susceptible to injury. Bone loss often advances silently, lacking obvious symptoms, which makes it especially deceptive. It is common for individuals to be unaware of their osteoporosis until they sustain a fracture. Fractures may occur from what might appear to be minor falls or even during routine daily activities, like bending over or lifting items. Typical locations for fractures due to osteoporosis are the hip, spine, and wrist. A hip fracture can greatly affect mobility and independence, frequently requiring considerable medical treatment and rehabilitation efforts. Moreover, spinal fractures may result in persistent pain, physical deformities, and a diminished quality of life, highlighting the necessity of taking proactive measures to maintain bone health. Various risk factors play a significant role in the onset of osteoporosis. As individuals age, it is important to recognize that bone density often diminishes following the attainment of peak bone mass during early adulthood. The influence of gender is significant as well. Postmenopausal women face an increased risk because of the decline in estrogen levels, which plays a crucial role in preserving bone density. Other contributing factors encompass family history, body frame size, low levels of physical activity, smoking, excessive alcohol intake, and insufficient nutrition, especially a deficiency in calcium and vitamin D. Preventing osteoporosis necessitates a comprehensive strategy focused on nutrition and lifestyle decisions. A well-balanced diet plays a vital role in supporting bone health, with calcium being an essential mineral that underpins the structure of bones. Adults typically need approximately 1 to 1.200 milligrams of calcium each day, varying by age and gender. To improve calcium intake, it is essential to include foods that are high in calcium in your diet. This includes dairy products like milk, cheese, and yogurt, as well as leafy green vegetables such as kale, broccoli, and collard greens. Additionally, consider fortified foods, orange juice, and cereals as part of your nutritional plan. Alongside calcium, vitamin D plays a crucial role in maintaining strong bones, as it enhances the body's ability to absorb calcium efficiently. This vital nutrient can be acquired through exposure to sunlight, consumption of fatty fish, fortified dairy products, and, if needed, through supplements. It is crucial to ensure sufficient vitamin D levels, particularly for those who may have restricted sun exposure or dietary sources. In addition to maintaining a balanced diet, engaging in regular physical activity plays a vital role in the prevention of osteoporosis. Participating in weight-bearing activities like walking, jogging, dancing, and resistance training promotes bone formation and may enhance bone density. Engaging in these activities exerts pressure on the bones, prompting them to adjust and fortify themselves. It is advisable to strive for a minimum of 150 minutes of moderate intensity exercise weekly, along with muscle strengthening activities on 2 or more days, alongside proper nutrition and physical activity. It is crucial to have routine consultations with healthcare providers to keep an eye on bone health, especially for those who may be more susceptible to osteoporosis. Healthcare professionals often suggest conducting bone density assessments, like dual energy X-ray absorptiometry, DEXA, to evaluate bone mineral density and detect early indications of osteoporosis. Early detection facilitates prompt intervention, which may encompass lifestyle changes, dietary modifications, personalized exercise regimens, and, in certain instances, medication aimed at enhancing bone strength. In conclusion, osteoporosis represents a major health issue that necessitates proactive strategies for prevention and management. By focusing on a diet rich in nutrients, participating in consistent physical activity, and remaining attentive to bone health through regular medical checkups, individuals can make crucial strides in preserving strong and healthy bones over the course of their lives. Item 8. Nodules are characterized as unusual lumps or masses that may form within different biological tissues across the body. These growths can present themselves in various forms and inflammatory conditions, such as rheumatoid arthritis or sarcoidosis, may result in the development of nodules in different tissues. Grasping the precise cause of a nodule is essential for assessing its possible effects on well-being and informing treatment choices. When a nodule is detected, often through a physical examination, imaging study, or even incidentally during diagnostic scans for unrelated concerns, medical professionals generally adhere to a structured method to assess its characteristics. The initial phase of this assessment typically includes a comprehensive review of medical history along with a detailed physical examination. This initial assessment plays a vital role in collecting information about any symptoms the patient might be facing, which can offer important insights into whether the nodule is linked to significant health changes, such as unexplained weight loss, a persistent cough, or localized pain. After this initial assessment, a range of diagnostic tests and evaluations are usually performed to gain a clearer understanding of the nodule's characteristics. Techniques like ultrasound, computed tomography, CT, scans, and magnetic resonance imaging, MRI, are frequently utilized to deliver comprehensive insights regarding the size, shape, and position of the nodule. The imaging studies provide essential insights into the nodule's features and its interaction with nearby tissues, which is vital for guiding appropriate management decisions. For example, the presence of calcifications within a nodule can indicate a benign process, whereas irregular borders or rapid growth may raise concerns regarding malignancy. In specific circumstances, a healthcare professional might suggest a biopsy to collect a tissue sample from the nodule. This procedure entails the extraction of cells from the nodule, allowing for laboratory analysis to ascertain their cellular composition. Biopsies are essential for distinguishing between benign and minimal nodules, offering clear information that informs treatment choices and eases patient worries. Understanding the context of nodules is crucial for patients and their families. The discovery of a nodule can understandably lead to anxiety, as it brings forth concerns regarding its nature and possible health implications. It is essential to keep in mind that most nodules are benign and typically do not require aggressive treatment. Numerous nodules can be observed over time with consistent follow-up appointments and imaging studies, enabling healthcare professionals to evaluate any alterations in their size or features. By conducting comprehensive assessments and careful observation, healthcare professionals can assist individuals in navigating suitable management strategies. This may involve a careful observation strategy for non-threatening nodules, medical management for existing health issues, or surgical options if there are worries about cancerous growths. Ultimately, successfully addressing the discovery of a nodule hinges on clear communication with medical professionals, who can offer insight and comfort grounded in a thorough understanding of the nodule's implications and the person's overall health condition. Creating a space for open communication and support allows individuals to feel empowered in managing their health, resulting in improved outcomes and less anxiety about their condition. If you are continuing to engage with this video and find the lessons beneficial, kindly comment number 4 below to indicate your ongoing participation in this learning experience. I appreciate your valuable time. Ninth position. In our younger years, The process of falling asleep often seemed like a smooth and easy shift from wakefulness to slumber. As we settled in for the night, it felt as though we were gently ushered into a profound and restorative slumber. Waking up the next morning feeling revitalized and renewed, the world appeared welcoming, and sleep seamlessly integrated into our daily routine. As individuals grow older, it is common for them to encounter notable shifts in their sleep patterns. What was once a natural and effortless process may transform into a nightly challenge, resulting in many finding themselves restless in bed, yearning for the serene rest they desire. Insomnia can arise from various factors, and recognizing these influences is essential for effectively tackling this widespread concern. A key factor in insomnia is the gradual misalignment of our biological clock, particularly our circadian rhythms, which govern our sleep-wake cycles. As we age, our natural rhythms may become out of sync with our daily activities and obligations, resulting in challenges in obtaining restorative sleep. Changes in lifestyle that frequently occur with age, including retirement, decreased physical activity, or shifts in social interactions, can intensify this misalignment, creating greater difficulties in achieving and sustaining a regular sleep pattern. Alongside biological changes, the pressures and challenges of life can significantly impact our mental well-being, especially during times of stress. The combined impact of responsibilities, concerns, and everyday pressures can result in increased anxiety and mental discomfort, hindering the ability to unwind and find relaxation during the night. As we age, our bodies experience a range of physical changes, including hormonal fluctuations, shifts in metabolism, and heightened discomfort from chronic conditions. These changes can lead to feelings of restlessness and the need for more frequent bathroom visits, which can further hinder our ability to attain restful sleep. Regardless of the many factors that lead to insomnia, it is important to address this issue with a serene and understanding attitude, acknowledging that sleep challenges are a frequent occurrence, especially in later years, can help reduce the anxiety and frustration that often come with restless nights. It's important to recognize that insomnia is not an overwhelming obstacle, but a condition that can be addressed successfully with patience and proactive approaches. To address insomnia and improve sleep quality, it is essential to investigate and apply different strategies that cater to personal requirements. Creating a regular sleep routine is essential for achieving this goal. Establishing a consistent sleep schedule by going to bed and waking up at the same time each day, including weekends, is essential for reinforcing our body's internal clock. Maintaining such consistency can facilitate a more natural process of falling asleep and waking up, ultimately fostering healthier sleep patterns as time progresses. Establishing a soothing bedtime routine can greatly improve our overall sleep quality. Participating in calming activities prior to bedtime, like reading a book, doing gentle yoga, or taking a warm bath, helps our body recognize that it is time to relax and get ready for sleep. Creating an environment that promotes restful sleep is essential. Creating an environment that is dark, quiet, and cool in our bedroom can significantly enhance our capacity to both fall asleep and maintain restful sleep throughout the night. It may be beneficial to incorporate blackout curtains, white noise machines, or comfortable bedding to establish a sleep environment that encourages relaxation. Furthermore, the choices we make in our daily lives significantly impact the quality of our sleep. Engaging in regular physical activity can effectively alleviate stress and anxiety, leading to improved sleep quality overall. It is crucial to refrain from participating in intense exercise near bedtime, as this could counteract your efforts to relax and prepare for sleep. Instead, prioritize gentle movements or stretching exercises in the evening to promote relaxation. Moreover, being mindful of dietary selections is crucial for achieving the best possible sleep health. Steering clear of caffeine and heavy meals in the hours before sleep can significantly aid in maintaining your sleep patterns. Engaging in mindfulness and relaxation techniques can prove to be quite advantageous in addressing insomnia. Practices like meditation, deep breathing exercises, or progressive muscle relaxation can effectively soothe both the mind and body, facilitating a smoother transition into sleep. Engaging in these practices throughout the day fosters a sense of tranquility that extends into the evening, thereby minimizing the chances of experiencing restless nights. Ultimately, if insomnia continues even after trying these approaches, consulting with a healthcare professional could be advantageous. A professional in sleep health can assist in uncovering underlying problems, offer personalized advice, and, when needed, recommend treatments or medications to aid in reestablishing healthy sleep habits. By implementing these proactive measures and adopting a comprehensive strategy for sleep management, individuals can restore their capacity to experience restorative nights and enhance their overall health. 10. Atherosclerosis, commonly known as arterial plaque, is a pathological process marked by the slow accumulation of plaques in the arterial walls, the buildup of fatty deposits. Cholesterol, calcium, and various other substances can result in the hardening and narrowing of the arteries, which can greatly affect blood circulation throughout the body. The development of arterial plaque is frequently viewed as a normal part of the aging process within the body's blood vessels, similar to how wrinkles on the skin become more noticeable as we age. The issue of arterial plaque is particularly alarming. Statistics reveal that almost 40% of individuals over the age of 40 are impacted by this condition. This condition can lead to serious health concerns, as the constricted arteries may limit blood circulation to essential organs. This limitation heightens the risk of significant cardiovascular complications, including heart attacks, strokes, and peripheral artery disease. Thus, it is essential to uphold a healthy lifestyle to prevent the development of arterial plaques and reduce the impacts of atherosclerosis. Participating in consistent physical activity stands out as a highly effective method for enhancing cardiovascular well-being. Engaging in physical activity enhances blood flow, helps manage blood pressure, and decreases cholesterol levels, all of which play a vital role in promoting healthier arteries. Engaging in activities such as brisk walking, swimming, or joining group fitness classes is crucial for maintaining heart health and should be a regular part of daily routines. Alongside regular physical activity, embracing a well-rounded diet abundant in fruits, whole grains, lean proteins, and healthy fats can significantly improve cardiovascular wellness. Foods abundant in omega-3 fatty acids, such as fish, and those loaded with antioxidants, like berries, have demonstrated protective effects against the formation of arterial plaque. Avoiding detrimental habits like smoking and excessive alcohol consumption is essential for maintaining well-being. Smoking is a major risk factor for atherosclerosis, as it harms the arterial lining and speeds up the accumulation of plaque. Keeping a healthy weight and effectively managing stress are crucial elements of a lifestyle that supports heart health. Excess weight can contribute to elevated cholesterol levels and heightened blood pressure, while ongoing stress may lead to detrimental coping strategies that threaten cardiovascular well-being. Consistent health evaluations are essential for keeping track of cardiovascular well-being. Regular screenings for cholesterol and blood pressure levels can assist in detecting potential risks early, enabling prompt intervention and necessary lifestyle modifications. For individuals who are at an increased risk of atherosclerosis, it is advisable for healthcare providers to suggest supplementary approaches, including the use of medication to effectively control cholesterol levels or blood pressure. In conclusion, the development of arterial plaque, known as atherosclerosis, is a prevalent occurrence associated with aging that presents considerable health challenges. Individuals can take proactive measures to prevent and manage this condition by adopting healthy lifestyle choices, such as engaging in regular exercise, maintaining a balanced diet, steering clear of harmful habits, and participating in routine health checkups. Focusing on cardiovascular health allows individuals to greatly lower their chances of facing severe complications linked to arterial plaque, paving the way for a healthier and more active lifestyle as they grow older. If you are continuing to engage with this video and find the lessons beneficial, kindly comment number 5 below to indicate your ongoing participation in this learning experience. I appreciate your time and insights. What are the potential risks of overtreatment on the body? From a medical perspective, excessive treatment can lead to significant risks for the body. Every medication or treatment method aims to address particular health concerns, but it is crucial to recognize that each one also has the potential for side effects that may cause harm if not properly monitored. When treatment surpasses the required threshold, it may initiate a series of negative responses that undermine overall well-being. The excessive use of antibiotics can disturb the sensitive equilibrium of gut flora, which is essential for digestion and overall immune function. This disruption could lead to issues like antibiotic-resistant infections, complicating the effective treatment of future bacterial infections. In a similar vein, excessive radiation therapy can harm not only the targeted cancer cells but also the surrounding healthy tissues, which may elevate the risk of secondary cancers and various complications. Unnecessary surgical procedures can jeopardize bodily functions, resulting in complications like infections, extended recovery periods, and potential long-term impairments in physical abilities. In addition to the physical consequences, excessive treatment can significantly impact mental well-being. The emotional strain linked to intensive treatment plans can amplify anxiety and depression in patients. The pressure of regular medical visits, the anxiety over possible side effects, and the unpredictability of treatment results can significantly impact mental health. It is crucial to consider medical interventions thoughtfully, evaluating the possible advantages alongside the risks associated with overtreatment. What strategies can we implement to avoid overtreatment? As people grow older, there is a common belief that numerous illnesses are on the horizon due to the inevitable decrease in bodily functions that comes with aging. To effectively prevent disease and reduce the risks linked to overtreatment, it is essential to focus on lifestyle modifications and the establishment of healthy habits. Ensure your biological clock remains consistent. Creating a reliable biological rhythm is essential. Establishing a daily routine that includes going to bed early and waking up early is essential for allowing the body to obtain the necessary rest for recovery and rejuvenation. Quality sleep not only improves physical well-being but also bolsters cognitive abilities and emotional strength. It is crucial to steer clear of late-night activities and harmful habits, as these can interfere with the body's natural rhythms, ultimately resulting in weakened immunity and a heightened risk of health problems. Embrace a balanced diet. A balanced diet plays a crucial role in preventing diseases, especially for seniors. It is important for older adults to focus on nutrition by incorporating a diverse range of foods that are high in essential nutrients such as proteins and minerals. Essential components of their diet should consist of fish, lean meats, eggs, dairy products, legumes, fresh vegetables, and fruits. At the same time, it is essential to cut back on foods that are high in fat, calories, salt, and sugar, as these dietary selections can greatly diminish the likelihood of developing chronic conditions like cardiovascular diseases and diabetes. Participate in physical activity. Engaging in physical activity is an essential factor in preventing diseases among older individuals. Participating in consistent, moderate exercise can improve the body's ability to fend off illness and decelerate the aging process. Older adults can opt for gentle activities like walking, tai chi, and yoga, customizing their routines to align with their individual preferences and physical abilities. Fostering a positive mindset is crucial for achieving overall well-being. Embracing a positive outlook and demonstrating resilience can significantly reduce stress levels and enhance immune health. Engaging in social interactions, be it through family gatherings or community activities, offers essential opportunities for connection. This enables older individuals to exchange experiences and relish the joys of their later years. Approach aging with composure and logic in facing the unavoidable transformations that come with aging. It is essential to uphold a composed and logical perspective. Organizing daily activities in a harmonious manner and prioritizing wellness can enhance the ability to cope with the difficulties that come with aging. It is crucial to sift through unverified information and rely on scientific knowledge, ensuring that health and wellness decisions are based on evidence-based practices. By adopting these lifestyle changes, seniors can greatly improve their overall health and well-being, minimizing the chances of unnecessary treatments and their related risks, while fostering a better quality of life. We appreciate your participation as we delved into the significant insights provided by these 10 diseases and their implications for our well-being. Recognizing these indicators can enable us to make informed decisions and focus on our health. And I am eager to hear your thoughts. What insights have you gained up to this point? Share an insight that struck a chord with you and that you intend to incorporate into your daily routine in the comments below. If you found this video valuable, we would appreciate your comments. Please remember to like, share, and subscribe to our YouTube channel for more insightful content like this. Let us embark on this path together, striving for improved health and well-being.